Hi everyone, it's week 6 in our 40-week journey through pregnancy.
This week's topic, where we're going to talk all about how to choose your OB provider and where you want to deliver your baby. There's some different options, and so our goal for today is to talk about what those options are and some of the related risks and benefits of each.
Oh, and it's week 6, which means we're going to get our very first chance to see our baby on ultrasound this week.
So in case you haven't met us, I'm Sarah and I'm an OBGYN.
I'm Kurt and I'm a pediatrician.
And we are the Doctors Bjorkman. Welcome back. This week we are talking all about the 6th week of pregnancy, and a big part of that is starting to think about where and how you want that little baby to be born, and also starting to think about that first OB visit.
So before we dive into that discussion, let's talk a little bit about baby. It's week 6 and baby is already about the size of a little sweet pea, measuring about 2.5 millimeters in length, and its little arms and legs are already starting to grow, which, if we're lucky, we might be able to see on that early first trimester ultrasound. And speaking of that, make sure you stick around to the end of today's video to see Sarah's first ultrasound and our very first look at baby.
To start our discussion about who you want to choose to be your medical provider for your birth, there are a couple things you need to consider. The first is, do you have any health conditions that might necessitate a higher level of specialized care?
And later in your pregnancy, this may be, does your baby have any special conditions that are going to necessitate immediate care after birth?
It's also important to find out what is available in your area. Are there multiple hospitals? Is there a birth center? Start to explore what those options are.
And what are your plans to cope with labor itself?
Are you hoping for a medication-free birth, or are you ready for that epidural right now?
And finally, what does your insurance cover? This may change some of your plans a little bit.
So there are essentially 3 options available for where you can choose to give birth: at a hospital, at home, or at a birth center. At a hospital, the providers that might be available to you are an OBGYN, an MFM, a family physician, or a midwife. And we're going to talk more about what each of those means in a little bit. So 98% of women in the US choose to give birth in a hospital, and there are many benefits to in-hospital birth, including access to specialized medical care for mom and baby should an emergency arrive, as well as medicated pain relief during labor.
Another option for birth location would be the home. So it is true that women through all of known history have been giving birth to babies at home, and millions have done so successfully. In fact, Sarah and I both have friends who welcomed their babies into the world at home. But before we begin the discussion about planned birth outside the hospital, we need to state that even the healthiest moms with the healthiest pregnancies could have unexpected things happen that could cause things to become life-threatening or significantly dangerous to mom or baby with little warning. And with this, the American College of Obstetrics and Gynecology continues to recommend, even in the COVID era, that the safest place to give birth is either at a hospital or an accredited birth center.
Yep, absolutely.
In fact, even now, the American Academy of Pediatricians and the American College of Obstetrics and Gynecology has statements addressing the increased risk of death, serious neurologic dysfunction, and lower APGAR scores in infants who are born at home. So with all of this, if you're still considering birth at home, there's some extra things you should consider.
So it is critical. If you are planning to have a baby at home, you should do so in the presence of a certified nurse midwife or a midwife whose licensure and education meet the standards of the International Confederations of Midwives Global Standards for Education.
With a little bit different view than ACOG, the American College of Nurse Midwives states that international and U.S. research results support the conclusion that a planned home birth with an educated, skilled attendant can be a safe, satisfying, cost-effective care option for healthy, low-risk women who want to give birth at home. So we fully support a woman's right to choose where they give birth, but need to stress the key points of this statement being that mom and baby are at low risk, and the home birth happens with an educated, skilled, and licensed midwife. And ideally, this is all near a hospital should additional care or support be needed.
The third option for birth location is a birth center. If you are someone who doesn't have a medical condition that necessitates an in-hospital birth, and you really desire limiting the medicalization of your birth process, an accredited birth center could provide a more home-like experience, as they're designed to be a bit more family-centered than a traditional hospital unit. Birth centers do have medical equipment and other preparations for emergency situations when a normal, healthy pregnancy becomes a dangerous situation for mama or baby.
The reason we spent so much time talking about where to give birth is that it's really going to help inform your decision about who is going to be your OB provider. Yeah. So if you are someone who is planning a birth outside the hospital or a home birth, again, please make sure your birth attendant is someone who has the appropriate training, education, and licensure, as we discussed previously. If you're part of the vast majority of women who will be giving birth in a hospital setting, your options for who your OB provider may be a bit more diverse. This is going to depend a little bit about where you live and what other medical conditions are affecting your pregnancy, but could be anything from like an OBGYN, a maternal fetal medicine specialist, a family physician, or even a midwife who's certified to deliver babies in your hospital.
So if you are someone who has complex medical issues yourself, or you discover that your baby has a complex medical issue or fetal anomaly, you will likely be referred to a higher level of care with a maternal fetal medicine specialist. So these are OBGYNs who have done 3 additional years of training in all things related to pregnancy and high-risk obstetrics.
And family physicians also deliver babies. So they classically see patients of all ages and are primary care for all sorts of medical conditions, including labor and birth. So if you live in a rural area, a family physician may be the only physician option you have available, but even if you live in a highly populated area, some of the benefits of going to a family physician is that you may already be seeing them for your medical care, and they could continue to care for you and your baby after birth.
So the next option is an OBGYN. OBGYNs are physicians that have done 4 additional years of specialized training in all things obstetrics and gynecology. So they are specialists in all things related to labor, birth, and postpartum. They are often the most experienced baby catchers in the hospital and are trained in emergency procedures and a C-section if that's something that arises during your birth process.
And then also midwives could be the person to be your OB provider. Yeah. They classically provide holistic care for pregnancy, birth, and the postpartum periods. If practicing in a hospital, they're usually supervised by an OBGYN, and may be a good midway choice for those of you who are looking to have less medical intervention with your birth process, but still want the safety of delivering in a hospital. Even if you do choose the midwife route, you could still get an epidural, could still have ultrasounds, or even continuous monitoring throughout that birth process if that's desired or needed.
So with all of these options in front of you, at the end of the day, you just need to pick what feels right for you. And one of the best ways to do that is to talk to women in your area who have recently given birth. Talk to your friends. Ask them what group they saw. Ask how they felt about their providers. Ask what their experience at the hospital was like, because they have recently done it and have a lot of insider information.
Absolutely. And some specific questions you might want to consider are, is this a group of providers? Is it a solo provider? Or if it is a group, does this group also have midwives?
If it's a group practice, you're going to want to find out if you're going to see the same provider at all of your prenatal visits, or if they rotate so that you meet all the different providers in the group.
And if it's a solo provider, which is pretty rare nowadays, you'd want to know who would be delivering your baby if that person was unavailable.
You're going to want to find out which hospital that this group or provider delivers at.
And then it's also really good to find out for this specific provider or group, how do they feel about things like birth plans, episiotomies, epidurals, VBACs, etc. And these topics we're all going to be covering in the upcoming months as we think about our own plans and hopes for birth.
And please remember that if the first provider or group you meet doesn't feel like a good fit, if you can, keep exploring, because it's really important that you have a good therapeutic relationship with your provider.
And at the end of the day, all of this planning, while great, may have to go out the window, as in things with medicine, things can change, and you may have to have some acute changes to your plans.
And so with that, if you are on your 6th week of pregnancy, it is time to start thinking about making that appointment for a confirmation of pregnancy ultrasound, where a sonographer will use a transvaginal ultrasound to look and make sure that that little embryo is in your uterus.
Hey everybody, I am here at the doctor's office about to go in for my early OB scan. Gonna make sure this little embryo is in the uterus. I'm about 6 weeks and 3 days, and so should see a heartbeat today. I'm here by myself. This is pregnancy care and COVID. Got my mask ready to go. I'm gonna make sure the sonographer prints me lots of pictures to take home to Kurt. Wish me luck.
Oh, Kurt's gonna love this. Oh, wow. Look at the arms. Those are arms. Oh, this is awesome. Head is to the right, tail is to the left.
So today, Sarah went for her 6-week confirmation of pregnancy visit with transvaginal ultrasound. A little disappointed I didn't get to go with COVID and partner restrictions, etc., but she did at least bring back some really cool pictures for me. The first here, you can see they actually take a measurement of baby's length. This is to verify dates, and from what we know of Sarah's LMP, these both match up, saying that she's 6.5 weeks along so far. They also do an M mode through baby's heart. We get to see baby's heart beating for the very first time. This is especially exciting to me as a pediatric cardiologist, and I'm sure it will be exciting to all of you to get to see your baby's heart beating already. And then finally, baby's first message to dad. Don't know if you can read this or not, but it says, "Hi, Daddy." Of course, this was typed in by the sonographer, but I'll take it. So excited to get to watch this little baby grow over the next 30+ weeks.
That is it for us this week. Please leave any comments or questions you have below about choosing a provider or choosing where to give birth. And if you've done this recently, let us know how it went. Let us know how you chose a provider.
We're really thrilled to be getting advice from you all, and the comment section can be a great place for all of you expecting parents to be supportive for one another.
So please leave a comment, click subscribe, and come back and see us next week for week 7 of pregnancy.
See you guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.